A sinus infection, also known as sinusitis, is a very common upper respiratory tract infection that infects millions of people every year. It occurs when the membranes of the paranasal sinuses, which are small air-filled spaces located within the skull around your nose, become inflamed. This causes pressure in your sinuses, which is due to a buildup of air and mucus in the nasal cavity. If you want to know how to treat sinus infection, so keep watching this video till end. We have 3 sections in this video: recognizing sinus infections, treating your sinus infection, and preventing sinus infection. You can always jump between sections of this video by timestamp links in the description below. Watch this video till end for better understanding. Let's start quickly. Recognizing sinus infections. Look for sinus congestion and pain. There are many common symptoms of a sinus infection. One of the main symptoms is sinus congestion. This is typically connected with a sinus pain as well. This pain occurs in the areas on and around your nose and is due to the pressure from the inflamed sinus cavity. This pressure often causes headaches. There may be pain when you move your head forward or when you touch the areas overlaying your sinus cavities. The maxillary sinuses, which are under your eyes, may be painful or uncomfortable as well when pressed or tapped. The symptoms can seem very similar to the common cold. The major difference is that with a cold, you will have congestion, but the sinus pain and pressure will not be as severe. See if you have discolored sinus discharge. One of the other major signs of a sinus infection is discolored sinus discharge. The color of the discharge will be green, yellow, or blood-tinged. This is due to the virus in your system, which causes discharge to change color. It will also likely to thick and might be hard to blow out. This is another major way to distinguish a sinus infection from a common cold. The nasal discharge you experience with a common cold is abundant and there is a lot of it. But it is clear, the discharge with a sinus infection will always have a cloudy and colored appearance. Take note of a cough. Along with the nasal symptoms, you may develop a cough as well. The nasal discharge often drains into your throat and lungs, which is called a postnasal drip. You may feel the sensation that it is draining to the back of your throat. This drip can cause a cough that may or may not be productive, which means that it produces phlegm. You may also develop a low-grade fever. This cough will not be set in your lungs. A sinus infection does not cause mucus to be created in your lungs. The cough you develop with a sinus infection is the way your body reacts to the postnasal drip. It is simply trying to expel the phlegm that travels to your lungs. Distinguish sinusitis due to chronic allergies. You can develop a sinus infection as a result of your allergies. The same pathogenesis that causes sinusitis is present with allergies, which sets the stage for the symptoms of the infection. For this type of sinus infection, you may have sinus pressure and pain for days leading up to the onset of the infection. The change in color of your snout notes when your sinus issues change from allergies to an infection. Chronic allergy sufferers may also have nasal polyps, which impede drainage and predispose you to infection. Treating your sinus infection. Get some rest. If you are continuing to not get enough sleep or work excessive hours, it will take your body longer to get rid of the infection. If at all possible, try to have a full 24-hour period of complete rest. Try to sleep with your head elevated. This will help promote drainage and reduce congestion. Drink plenty of fluids. Staying hydrated will help thin the mucus and reduce the feeling of blockage. Water is the best option, but non-caffeinated tea, sports drinks containing electrolytes, and clear broths are also good options. Men should drink at least 13 cups or 3 liters of fluid per day. Women should drink at least 9 cups or 2.2 liters of fluids per day. If you are sick, you may need even more. Avoid alcohol. It can actually make the swelling in your sinuses worse. Caffeine may dehydrate you, which could make the mucus thicker. Try a neti pot or nasal syringe. Flushing your sinuses can help clear out built-up mucus naturally. You can do this several times a day with minimal side effects. Use a sterile saline solution in the pot or syringe. You can buy a prepared solution or make your own using distilled boiled or sterile water. Tilt your head at about a 45-degree angle. You will want to do this over a sink or in the shower to make cleanup easier. Place the spout of the neti pot or the tip of the syringe into your top nostril. Gently pour the solution into your nostril. It should run out the other nostril. Repeat on the other side. Inhale steam. Steam will help keep your sinuses moist and may make it easier for you to breathe. Take a hot shower or inhale the steam from a bowl. Using a mentholated shower can help. To use a bowl, carefully pour boiling hot water into a temperature-safe bowl. Lean your head over the bowl. Do not get so close that water or steam burns your face. Cover your head and the bowl with a light towel. Inhale the steam for 10 minutes. If desired, you can add 2 to 3 drops of eucalyptus oil or other decongesting oil to the water. Use 2 to 4 times per day. If using this method with children, use extreme caution around the hot water and do not leave children unattended with the hot water treatment. Run a mist humidifier. Dry hot air irritates sinus passages, so running a humidifier while you sleep will help make breathing easier. A warm or cool mist humidifier should work equally well. You can also add a few drops of essential oils like eucalyptus into the water in the humidifier, which will help further reduce congestion, but check the humidifier's user manual before adding anything to the water. Apply a warm compress. To ease facial pressure and pain, apply a warm compress to the affected areas. Moisten a small towel and microwave it for about 30 seconds. The towel should be quite warm but not hot enough to be uncomfortable. Place the compress over your nose, cheeks or near the eyes to reduce your pain. Leave on for 5 to 10 minutes. Eat spicy foods. Some research suggests that spicy foods such as hot peppers or horseradish may help clear your sinuses. The capsaicin in peppers and spicy foods may help thin mucus and promote drainage. Other spicy foods such as ginger may also help you feel better. Drink tea. Hot, non-caffeinated tea may help soothe a sore throat, especially if it contains ginger and honey. This can also help reduce coughing. However, you should avoid teas with too much caffeine, as these may dehydrate you or cause you to lose sleep. You can make a simple ginger tea at home. Grate about 1 ounce of fresh ginger per cup of boiling water and allow to steep for at least 10 minutes. Green tea may help reduce nasal and allergic symptoms when drunk regularly. Treat your cough. Often a sinus infection will be accompanied by a cough. To ease your discomfort and inconvenience of a cough, you should stay well hydrated. Drink warm liquids such as herbal tea and take honey. Stop smoking. Cigarette smoke, even secondhand smoke, causes irritation of the sinus lining and promotes sinus infections. You should stop smoking and avoid secondhand smoke while you have a sinus infection. To prevent future sinus infections and promote better overall health, stop smoking entirely. Smoking harms basically every organ in your body and can take years of your life expectancy. Preventing sinus infection. Treat symptoms of allergies and colds. Inflammation in the nose caused by allergies and colds predisposes you to developing a sinus infection. Get a flu vaccine. This reduces your likelihood of catching the influenza virus, which is another common culprit causing viral acute sinusitis. Avoid pollution. Exposure to the polluted environments and contaminated air may irritate the nasal passages and aggravate your sinusitis. Chemicals and strong fumes may irritate your sinus lining. Practice good hygiene. Viral infections are the most common causes of sinusitis. You can reduce your risk of catching these infections by washing your hands frequently with soap and water. Wash your hands after shaking hands, touching public surfaces such as bus poles or door handles, and before and after preparing food. Drink lots of water. Water increases the amount of moisture in the body and helps to prevent congestion. It also helps to thin the mucus for proper drainage. Eat plenty of fruits and vegetables. These foods are rich in antioxidants and vitamins, which will help keep your body strong and healthy. Foods such as citrus fruits have high levels of flavonoids, a compound which may help boost your immune system and fight viruses, inflammation, and allergies. This was all for now. Share your experiences, reviews, and questions in the comment section below. Hit the subscribe button and ring the bell icon for more videos and updates. Follow us on social media and don't forget to check our community tab posts. Thanks for watching. See you in the next video.